Assalamu alaikum. You're watching another edition of At Home with George. Welcome to another edition of At Home with George. आज मैं बहुत खुश हूँ क्योंकि we have a special guest, special guests from the NICH. That is the National Institute of Child Health, and it is one of the leading, if not one of the only leading child hospitals in Hamara Mulk, and it has done some fantastic work. I was introduced to it by my friend Shamira Akram, and it really blew me away because not only due to the quality of the healthcare that they provide to people, free of cost at the point of delivery, but also the fact is that they do not turn a single person away. And it provides a huge healthcare cover for the most vulnerable children in our society across Sindh, Balochistan, and southern Punjab. It is a really fantastic organization, and I'm delighted to welcome, first of all, the director of the NICH, Professor Dr. Jamal Raza. Assalamu alaikum, Dr. Raza.
Assalamu alaikum, George. How are you? It's a pleasure meeting you again.
Pleasure meeting you, albeit at a social distance.
It is very necessary at the moment.
It is necessary. Also, mera pehle sawal aapke liye is there any? Are you seeing any cases at the NICH of COVID-19 bachche ke saath?
Yes, of course. But fortunately, jo numbers hai, like so far, the recent data today is that we have got over 13,000 cases and 281 deaths in Pakistan. Fortunately, as in the rest of the world, less than 20 years, the numbers are much smaller. So about 7% of them have been, of all the cases that have presented, are below 20 years. So hamare paas bhi numbers aaye hain. We've got about 10-12 patients who have been COVID, but they fortunately, jaise bachon mein the severity of the disease is much less compared to the older age group. So they've all been well and they've been sent home. So we have been, touch wood, fortunate so far. But we are not over the hill, and that's what we fear. So we are fearing the worst. Allah kare ke aisa na ho, and we remain like this and get over with it. But we are still fearing the worst, and we are establishing a 25-bed COVID-specific ICU at NICH just to deal with children, just in case they get worse, and if the numbers soar, then we should be ready for them.
And are you expecting that to soar, or is this just a precaution?
I think we are taking precautions because we don't know where this is going to go. Some of us have bad fears that the numbers will escalate. We haven't got to the nowhere near the peak. So touch wood, Allah kare ke aisa na ho, and we get over with this sooner. But we have to be ready for the worst.
Right. Okay. And the other thing is that we're obviously, COVID-19 is taking up a lot of space and a lot of oxygen in terms of public debate, but we're not actually looking at the other impact it is having on children. For example, the reduction in immunization of various diseases from measles to polio, etc. And you're seeing, am I right?
Yeah, that's a very...
Sure, carry on.
Absolutely, that's a very serious issue because there's so much, everybody is into COVID so much that a lot of other things are being neglected, inverted commas, at the moment. One of them is the vaccination. While everybody in the world is waiting for a vaccine for COVID to be made and be available for people to use it, unfortunately, the vaccines which are already available are not being used appropriately. And we've been talking to the immunization people, and they said that there has been a 60%.
Hello? Hello, I think we have lost Dr. Raza. Dr. Raza, if you could perhaps log out and log back in. I think we've lost you there. But in the meantime, I will bring in Dr. Aneeta Afzal. And Dr. Afzal, and for those who don't know, Dr. Aneeta Afzal is a child adolescent psychiatrist in Louisiana, US. She is the president of the NICH US Chapter and has been instrumental in the NICH introduce child adolescent psychiatric services, as well as being the first of its kind in a public sector hospital in Pakistan. And without her input and constant guidance, it would not have been possible. So I'm really thank you for joining us all the way from Louisiana in the US. First of all, can I ask you why, based all the way in the US of A, you decided to get involved with the NICH?
George, I mean, it makes sense, you know, if you look at it, most Pakistanis based in US, most of us feel like we should do something for our home country and give back to our country. And as a physician, you know, it made a lot of sense to me to do something in this field. And you have been to NICH yourself, and you said it, that it just, when you go there, it blows away your mind. I mean, it's, you cannot just go and just leave and not think about it. It just, a part of you stays there. So go ahead.
Your heart.
Yes, exactly, your heart. And you just can't stop thinking about it. It's just amazing what they do, the way it works, the facility itself. I mean, 500 bed just for children and free of cost. And when I went there, which was year and a half ago, the first time, I did not expect to see so much. And I don't know why, I'm sorry to say that, but the dedication and commitment of physicians and the staff there. So it was not their misery or their suffering. Not only that, it was not just that the suffering stayed with me, it was just the hope that I felt.
Yeah.
The commitment and dedication and honesty, that was just really, that made an impact on me.
I think you've hit it on the head, because you think, you know, going to a children's hospital would be extremely depressing place. And whilst you are, you know, open to a lot of heartache and hurt, seeing these vulnerable children in the most appalling physical health, but at the same time, as you rightly point out, there is an enormous amount of hope in that place, and the fact is that people are giving their all to ensure these children are looked after and survive, and as you say, at the free at the point of delivery. That is what's so amazing, and at a high level of expertise as well for a public hospital.
For a public hospital, their ICU, the ventilators, everything that they have, and I felt like that we need to do something to help them, and we owe it to them, and it makes perfect sense to me. I mean, working with children, it's working, with our next generation, our future. Makes sense. And I'm a child psychiatrist, so of course, my heart was there. And after finishing my fellowship, I was able to go back and live in Pakistan for 4.5 years, and I was able to practice as a child psychiatrist. So I knew, that there was a big need, and unfortunately I had to leave, but again, my heart was still there. And with NICH, Dr. Jamal gave me this opportunity, and I really feel blessed actually that I have this opportunity, that I can work with them, that they are letting me do that for them. And it's just not me. There are so many other physicians with me.
Well, let's bring in Dr. Jamal back in. I think,
Yes.
inshallah, he's with us back now. Hello, Dr. Jamal.
Hi, how are you? I'm sorry the line got dropped.
Sorry about it.
So yeah, I was listening to you and Aneeta talking about it, and I'm very thankful to her for bringing in the services of child psychiatry, and which was greatly needed and is greatly needed in this community, because we have almost none, very few child psychiatrists. So we have established a service with their help, जहाँ पर इनकी टीम continuously help करती है. यहाँ पे हमारे पास physician उन्होंने place किया है, which they are also providing training. So that's really an amazing thing. Similarly, on the same line, the new service that we have started is that we have formulated a team of intensivists in the United States. So they are Pakistani-based intensivists who are taking a virtual round of our ICU or intensive care unit on a regular basis every week. So, and it's a fascinating thing because we can both learn from each other, and providing a top quality service at the public sector hospital where a US-based intensivist is directly taking the ward round and, you know, involved in the day-to-day management of patients at the public sector. So I'm very pleased that this has happened, and this is really a very unique milestone.
And for those who are ignorant like myself, what is an intensivist exactly?
An intensivist is the one who is looking after the intensive care. So the ICU personnel who is the expert in the ICU, because ICU have a very unique area. So people who are dealing with ICU as an in charge on a day-to-day basis are called intensivists.
Right. Okay. I'm just going to bring in a question now, and it might be applicable for Dr. Aneeta as well as you, Dr. Jamal. This is a question from Pfizer Gul, who says, what about quarantine facilities for children infected with COVID-19? I mean, how can we keep them emotionally calm? So if your child does display symptoms, should they be brought into NICH, or only if they're having trouble breathing, and should they just be quarantined? And also, how can we keep them emotionally calm?
Yeah, as a general principle, let me respond to this first, and then Aneeta will tell them how to keep them calm. Because as far as the medical condition is concerned, only COVID positive children or adults need not to be admitted to the hospital. Rather, they should stay away from the hospital. There are quarantine places where they can be kept, or sometimes, you know, if the facility is there, they can be quarantined at home also, which is, of course, a much better environment. But the whole protocol of quarantine need to be followed. How to keep them calm? Let Aneeta talk about it.
It's a difficult thing, of course, and it's an interesting question because the way our world is now, and I don't know, the lady who asked this question, it also depends on what resources you have available at home. You know, if you belong to a family where you have access to internet and you have all these electronic toys, then I guess it's not going to be such a hard thing. But if you don't have that, then I don't know. I mean, in Pakistan, living in Pakistan, I think the most important thing that comes to my mind is that parents need to understand and stay calm. If you are calm, then you will be able to answer questions. You can explain it to your child कि भाई अभी तुम बीमार हो, तुम्हें 2 हफ्ते हम घर पे रहेंगे. Maybe we can come up with some activities. Let's color, let's draw. Parents will have to understand and stay calm in that situation, and only then your child will be able to understand what's going on. Create little activities for them, choti cheezein, you know, ask them, okay, why don't we just color, let's read a book, or but yes, it's a difficult task. It's a difficult task, something that, you know, we are all learning from this experience how to go about it.
Also, there are clear guidelines as to how much interaction you should be doing when they are in quarantine. And quarantine means that they don't need to be in the hospital, but they are also quarantine centers. So if your home doesn't have enough space for them to be kept separately, then they can be kept in one of the quarantine centers which are available.
Jamal, masks can, in this situation, and people can make masks at home, right?
Yes. Yeah, but current जो अगर COVID positive है तो उसमें आप homemade masks are not enough. You need to
No, but
use
yeah,
the yeah.
but we have to keep it in mind that we are talking about Pakistan, jahan pe not everybody can afford to have a big space. So some of them are going to be in like this one bedroom little house. And if they have to do something, we have to educate them and teach them and educate them, whatever possible way, Choti si jagah hai, chota sa ghar hai. Yes, you need to be in your corner, and there is not a whole lot that we can do, and also have your mask. So, education and awareness about, how to go about it.
Okay, Dr. Aneeta, I just want to bring in, I want to play devil's advocate a little bit with you now, because you brought in these adolescent and child psychiatry services into the hospital. And what do you say to those people who say, well, surely our focus should be on making children sort of physically better. We've got limited resources. Why are we focusing on the mind? Why aren't we just getting them physically better? Because that's the most important thing, isn't it?
You know what? It's a very good question, and it's a little bit complicated because in third world countries, you're right. People talk about it, and a lot of people ask me this question: कि जिस मुल्क में खाने को ना हो, बच्चों के पास enough. What's the point? Why are you doing this? But it's amazing that how many patients, when they come in, mind and body, I mean, we all know that there is this big connection. You have to make sure that your mind is stable for you to do well in life in general, even when it comes to physical health, for you to understand how to take care of yourself. Your mind has to be there. It has to be stable. And then bachon ke liye family support. And that's why, we have to figure it out on our own cultural needs. And that's why I find and I see it so unique and helpful to my cause, because this whole hospital is designed for children. And so I find it very exciting and very helpful, actually, that we can create something for children based on our own culture. Jab parents aate hain, when they come, a lot of times they come and they bring their children in for physical problems. And then, physicians refer them for, okay, bhai, we have done everything, we can't find anything. And okay. So now they're developing this concept. And I was actually there. I did a couple of clinics at NICH, and it was just amazing and very, I shouldn't say rewarding experience because it was not enough, but just to see that parents are willing to understand and they know that they can help their children, especially when it comes to things like learning issues and ADHD and things like that, things that affect their future.
Let me also comment, because the body and the mind are not separate. I'll give you a very simple example. We have children with diabetes. We have children with diabetes who need to be injected 4 times a day, and then separate blood testing. So you cannot manage a child with diabetes unless the child is ready to cooperate and have been mentally accepted the problem. So a lot of these children undergo depression, the long-term illnesses. They undergo depression and need psychiatric help. And also, the number of psychiatric illnesses in our society are, much less accounted for than they really are. Log accept nahi karte कि जी बच्चों में भी ये problem हो सकती है. Even adults, people are still, it's a stigma, it's a taboo to accept that somebody in your family has a psychiatric, even depression, simple depression, people go into denial that they don't have depression, and they don't seek the help of the psychiatrist.
And as you quite rightly said, Dr. Aneeta, as well, that it's often children will present physical symptoms like I had somebody on this show on Saturday. She's a parenting expert, and she was saying, often children talk about having a tummy ache, and actually it's just because they're not able to process their feelings, or they're not able to articulate their feelings, that they talk about having a physical symptom like a tummy ache. And actually, you present a physical symptom, which, as you say, doctors can't find, but actually it's because there's a psychological symptom.
Yes, definitely. And another thing is that, George, kids are our identified patients, meaning that a lot of times they come to us because of their family issues. And
Right.
so they are actually, yes, they're coming in and they're your patient, but you know that there is a lot going on with them, around them. So it helps a lot, because you treat not only your patient, but you also treat and work with their families. And in Pakistan, it's very important, again, because of our culture and our values. We have to include, we have to work with our families. And that's where when I started talking to Dr. Jamal about child psychiatry, I was very excited because, again, they see thousands and thousands of patients. And just imagine if you can educate and make them aware of psychiatric issues or mental issues, or simple, just ADHD or learning problems, and you don't have to beat up your child just because he or she is not doing well academically. Maybe there is something else going on. I mean, there is so much that we can provide, and they have this perfect environment for
Dr.
us.
Jamal, have you found any pushback by introducing the child psychiatry services?
No, on the contrary, it has been a service which is very welcome, because there was a great need, both in terms of even physicians. When we as pediatrician wanted to send our child for psychiatric help, we were at a loss, because there were not many places who were offering the services, even in the private sector. So yeah, people are very happy, and of course, those who are getting the services are remarkably thankful कि जी आपने सर्विस हमें provide की है, and we are getting very exciting results, and they are directly in communication with Aneeta and the whole child psychiatry group in the United States. So that's an additional help. And also,
Right.
we are in the process of training more and more people, so that we can establish a more regular services in Karachi, not just at NICH, also elsewhere.
So just bringing back some comments, Pfizer Gul has written back, thanks, going back to the COVID thing and the quarantine, that's what we normally do. But if a child is infected and the family has an elderly person living in the house, then these all things get more difficult. Yeah, so what happens if we have a child that is infected by COVID-19 and obviously Dadi or Dada is living in the house, or Nani or Nana, what should they be doing then?
But there's a very clear guideline. When you are in quarantine, you are in quarantine. You are not allowed to see elderly or people who are not infected. I mean, if you are getting into contact with anybody who's not infected, then the whole protocol has to be followed with the protective gear.
If you're living in a one or two bedroom,
and especially if you have an elderly at home who is not infected, then you are putting them at a very high risk living in the same environment. Then you need to move your child out to a quarantine center.
Right. Okay. Lovely efforts, Aneeta. Somebody's saying.
Thank you.
Mariam Khan is kudos and respect to all the parents dealing with children's emotional and physical health issues during quarantine, and to health workers all over. You guys are amazing. Yeah.
That's nice. Let's hope that we can make a difference.
So
we all have to play our part.
Yeah, and just for those Dr. Jamal who don't know the National Institute of Child Health, as I said in my introduction, I was, I've lived in Karachi on and off for takriban 15 saal ke liye, and I knew of Jinnah Hospital, but I didn't know of NICH, which is obviously Jinnah Hospital ke baad. And and when I went with Mirados Shinira, and by the way, she's written saying, big fan, guys. I was blown away because it is a fantastic facilities that you have there. You have over 500 beds, and you treat takriban kitne log her sal, Dr. Jamal?
We see about over 1 million patients every year.
A million patients.
About 300, yeah, about 300,000 in the outpatient. You have like 29,000, 30,000 admissions a year. We do about 10,000 surgeries in children because not many places have pediatric surgeons available. So we do about 10,000 surgeries in children every year. And
Okay, hello, are you there, Dr. Jamal? So I think we've lost Dr. Jamal. Hopefully he can log back in. Dr. Aneeta, so obviously, what would you say to people, Pakistani diaspora, living in the US or in the UK or Europe, watching this right now? Because we've got people calling in from Norway, we've got somebody in from the UK, we've got somebody, they're all saying hi. What would you say to them about why we should be supporting NICH rather than, there are lots of other fantastic, well-run charitable organizations in Pakistan. We have TCF, we have the ED Foundation, etc. Why NICH for you? Why did it strike a nerve for you that so much that you wanted to raise money as well as give your time and attention to the organization?
Like I said, it makes perfect sense. Our future, our next generation, why not? I mean, that's my question. Why not? This is our next generation, our future. We need to make sure that they're healthier and happier. We have to make sure. And NICH they have this unique position. It's a big institute. They have very committed. And like I said, that I was impressed by their commitment. Dr. Jamal and his team and his, all these young physicians, I was very impressed. And I was impressed with their commitment, their honesty, and I feel that they are trying their best to make a difference. And if we can help them, I think it will make a big difference, because it's not just about, okay, so the program that we are running, I mean, the funds that we are collecting, it's not just about sending money or equipment. There is a lot more to it. It's about education and, providing more education, more awareness, workshops. We are arranging for so many different things. And that's where I feel like that our program is very unique. What we are trying to do, it's not just, okay, we're going to buy this ventilator for them. We're going to buy some medicines for them. Yes, we're going to do that too, because they need it. But we are also going to provide expertise. That's what, I think that's a big difference. We are trying to make a difference. We want to make sure that, like, for example, my goal for child psychiatry is to train them enough, but they don't have to depend on me.
Yeah. Yeah. So the NICH is really pushing the boundaries of what is possible in terms of pediatric healthcare in Pakistan.
Yes.
And often it sounds terrible, but like in public health, public hospitals, there is a sort of complacency or a tendency to say, public hospital here. We're not going to be able to compete with, Aga Khan or any of the private hospitals. What I loved about Indus when I went there is that you guys were really wanting to step up and compete with the best of the private hospitals in Pakistan. I mean, little things like I remember going into into the ICU, the new ICU, and it had this air filtration unit that would make sure that between the corridor where you enter and the corridor where you enter the ICU, all of the sort of bugs and bacteria are sucked out. And that is a next level type of system that you wouldn't expect to see in a public hospital. Oops.
Hello.
Can't hear him, but I think he nailed it.
Yeah.
Because exactly that the opportunity. I mean, I felt it that if that you guys have given me a chance to come in and do something, you know. Unfortunately, we don't see that.
Sorry, I'm back again. I don't know what
that's
of what I said.
You're sure?
But basically, what I was saying is that NICH, it's trying to compete and wants to compete with the very best in terms of hospitals.
Yeah, that's what our aim is, that we should not just accept the status quo and just complain about the difficulties that we have, but rather than do our bit and try and improve things as much as we can, and keep up the work, taking it to a even in baby steps, but take it to a higher level and provide. Why not provide the best services to the most most downtrodden, or the ones who are in the highest need for that? Can I say a piece of poetry in your program, George?
Sure.
Or is that too difficult?
No.
एक छोटा सा शेर है कि गिलाए ज़ुल्मते शब से तो कहीं बेहतर है अपने हिस्से की कोई शम्मा जलाते जाए. Rather than just complaining about the darkness, I think the best we should do is that lit our own little candle in the darkness and move on, and let the others do the job.
Yeah, and that is why you are so heavily involved, both of you, in terms of not just relying on the government funding for the hospitals, but also getting in private donations. So can I ask sort of what percentage of your funding is government funded and what percentage is coming in from private donations? And what are those donations used for?
Yeah, I mean, of course, the major chunk still comes from the government because they are responsible for providing the salaries and the maintenance of the hospital and lot of medicines. But the load is so much, especially with the newer departments that we have established, the more number of children coming in all the time, because the only dilemma is that when you improve your services, then you get more patients because they are referred from everywhere. So the government funding that we get is not enough to meet all the requirements that we have, and therefore we are requesting the private donors, for example, the ICU, that it's not just about establishing the ICU, it's also about providing the quality care, the best medicine, the best care, and of course that costs money. So that's why we need people to continue helping us out, and also we need to now, as you said, move a step ahead in the other directions, not just ICU, but also add on other services. We've just added a very state-of-art medicine dispensing unit where all the medicines are procured, they are formulated, और वो बिल्कुल जिस तरह से किसी भी बेहतर जगह के ऊपर medicines बना के IV infusions are made on the patient name basis and then delivered to the patient. So little bit by bit, we are trying to get to the standards, international, national, as well as the international standards. So whenever you try to move up move the bar or take the bar a little higher, that costs money as well as costs more effort.
Right, let's bring in now Dr. Hussain. Dr. Hussain Haideri is, hello, can you hear us, Dr. Hussain? Hello, Dr. Hussain. We can't hear you or see you. So, hello? Dr. Hussain? No, we can't hear or see you. If you could perhaps log in again. But for those, we wanted to obviously speak to Dr. Hussain Haideri, who's a nephrologist in Dallas, Texas, and he is also the treasurer of the NICH USA Chapter. And he's obviously did a lot of the spade work, was quite instrumental in making sure that the USA chapter got official charity status in the US. I mean, that's not an easy thing to get, is it, Dr. Jamal?
No, it's not. And Aneeta would bail me out that we have been making this effort for a couple of years now, almost. Especially in this changing environment globally, you know, people are very skeptical and very careful about the word NGOs and the money transfers, and you know, when the name of Pakistan comes in. So, you know, there are lots of question marks from, especially if you're based in US. So fortunately, we have been working on it, and with the help of everybody, Aneeta, Hussain, and a lot of other folks who are there, we have been able to get it going. It was very important in the US perspective because it's much easier for people who are living there to donate because they get the tax exemption.
Dr. Jamal, sorry, we've lost you again. Dr. Hussain, are you there? Can you hear me? No. Okay. Dr. Jamal. Yeah, I mean, Dr. Aneeta, how difficult is it for you to get charity status in the US? Because presumably their concern for someone like Pakistan is, you know, money laundering, terrorist funding, all of that is probably high on their list of concerns.
It was difficult, and but we were committed, and we were not going to give up. And so it took us 2 years almost, actually. And we applied and we waited, and it's funny, we got the status of a non-profit right away, but tax exemption is something that takes time. And we just got this good news in the middle of this craziness, this virus going around, and I get this letter that, you know, where we are ready, you know, the tax exemption was, um, we were given that status, so we are ready now. So like I said, in the middle of this craziness, we got this good news.
Well, let's speak to one of the people that are responsible for that. I think we have him now, Dr. Hussain. Assalamu alaikum.
There he is.
Walaikum assalam. Can you hear me?
Welcome to the show. I'm sorry it took so long. We're all sort of dealing with slight technical gremlins today, but thank you. So you are based in Dallas, Texas. You're a nephrologist there, and you are also the treasurer of the NICH USA Chapter. So how did you go about getting this tax exemption status?
So, you know, one of the beauties of the setup in the United States is that it is above discrimination for help based on religion, nationality, ethnicity, origin. And what we decided when I was fortunate enough, like Aneeta, to visit NICH Pakistan, the three things that were striking were the boldness and the audacity with which such a daunting task that was at hand was being handled by a team which appeared completely selfless. And obviously, being from the system like Pakistan, that is not something you see every day. And to see the CEO, Dr. Jamal himself, rolling up his sleeves, walking up and down the aisles when he took us down for the visit, interacting with everybody, right from the person who opens the door and closes it, to the person sweeping the hallway, to the ICU director, and then making phone calls in the room with high-ranking government officials, and then at the same time asking somebody to call the next parent in. That motivation, that dedication, and then the need, those factors combined were enough to tell those of us fortunate in the United States that this is time for us to, uh, uh, extend a lending hand and to say, what can we do to make a difference? What can we do to assist you? Because you're the one in the trenches. You're the one who's doing all that work. So we decided that one of the best options would be, as Aneeta was saying so eloquently a few minutes ago, to set up a team in United States that addresses and helps Dr. Jamal in our very small way, I must say, but helps him by giving him resources which are financial, giving him intellectual resources in the form of like Aneeta is doing with Skype meetings and all, and then provide any logistic assistance. And one of the ways to do that without being a burden for those who work here who are already spread out, because you have to admit that the donors and people in United States are already stretched out and doing so much. So one of the ways to do that is to create what's called a non-profit organization. The sole mission of which is to show what we do is not for any specific reason except for humanitarian. And whatever we do, every dime, every penny, every minute that's donated, every ounce of energy that's donated is all done purely, as we say, fi sabilillah, only done for the betterment of the people, to assist the warriors like Dr. Jamal. And we here in the United States, the team facilitating that, is doing it with no other intentions. And that's why we created this nonprofit. So we contacted a legal team here to make it look, because post 9/11, the paradigm has changed. And every little bit that you do is sometimes is scary for people. Things are looked under the microscope. Is it going for legitimate reasons? Is this money being channeled? Are the resources being used as suggested? Who is accountable for them? I've given my money. Is it reaching the people that it was intended for? So to do all that, the first and foremost thing was to create a team of people who are themselves very dedicated, who have a standing, who say, look, I'm jumping into this, and I'm not just asking you to jump into it, I'm there with you. Second, to consult a group of attorneys and officials to say, look, we want to do this right from the step one. So we are not doing anything that's remotely considered shady, illegal, or dicey, and that's out of the way. And then we've created this group, which is nonprofit, which means that anybody in the United States donates a single penny. All that money is going directly for benefit. Nothing is kept with us. It'll be transparent. We will have all the tracks for it. And all of that is done under a protection which the US government, as amazing as they are, provides you by letting you say every dollar that you donate, you can get an exemption from your government in United States to say, I don't know to pay taxes on it, because that's the money I've given for charitable work, for noble work, for humanitarian work. And United States allows you to do that irrespective of whether the money is used in the United States or abroad. Obviously, what we have to do is to follow all the laws and regulations. Sure. And by doing the 503c chapter, it makes it easier for people to feel comfortable to donate. It makes it easier for them to come forward and not be worried about accountability, because we'll keep it transparent. And we will involve a group of people for this who have a track record of doing this. And there will be no level of there's ambiguity about this. It will be all transparent, all clear.
Well, if you do want to donate and you're based in North America, USA, or Canada, the donation the details are on the screen below, and they're also at the bottom as well. So I'm just going to put you on mic, Dr. Hussain. Dr. Jamal, are you there? Can you hear us, Dr. Jamal?
Yes, I can hear you.
You were so still, I thought you were frozen.
No.
And again, I'm going to put a devil's advocate question to you again. There are a lot of organizations in Pakistan, good charitable organizations, spend a significant amount on marketing and selling their charity to the diaspora as well as to people here in Pakistan. You don't tend to do that. Most of your money, from what I can see, goes to frontline services, and you have a limited, if any, spend on terms of marketing. Why do you do that? Would you not be better in getting more if you'd spent more in marketing?
No, we've made the conscious effort that it's a public money and it is being donated for a cause. So I think that we try and use maximum of that money to directly benefit the patient, because the need is so much that we really feel very bad spending the money anywhere else, even for the marketing, even for printing brochures, circulating. We try and do as much of that as we can on donation basis and save the money to benefit the patient. And of course, we have the auditors, which are one of the big auditors available for us, who are looking into the accounts and producing audited reports as required. So we try and be as transparent as possible for anybody to see, because generally with the public sector, again, the skepticism is there that people are afraid that the money will not be utilized. So our accounts and our ways of how do we utilize this money.
Oh, we lost. Sorry, we've lost. Dr. Jamal, have we lost you?
Yes.
Oh, no, you're back. Oh, no.
So I was saying that we try and keep our accounts and our ways of spending very open for anybody to see. And I think we have lost it again.
Keep going.
Keep going.
Okay. So I think people can have their faith, and whoever wants to visit can come and see for themselves the work that we are doing and where the money is being utilized.
Great. Let's go to some questions. Obviously, anyone watching, if you want to learn more about NICH, visit their website, which is www.nich.edu.pk. It's at the bottom of the screen. This is a very nice question. Oops, sorry. I froze. Dr. Raza, it's such a wonderful and rewarding work you are doing in Pakistan. It'd be great that we can get little hubs of NICH in all over Pakistan. Lovely to hear you all. Yeah, are you looking to expand your services beyond sort of Sindh and Balochistan?
Yes, that's something that we have been discussing with the Chief Minister of Sindh, and he has actually offered, and we were in the process of getting it done before we were hit by this COVID thing, and everything has now taken a back burner. So we hope that once we are over with this episode, then we've already established another NICH trust, and we are trying to develop small centers where we can provide them training. जैसे USA वाले यहाँ को लोग train कर रहे हैं. The whole idea is to develop the capacity in the other areas where the capacity is not there. But not just, we can't go and work there, but we can help them develop a linkage and develop their human resource. Because end of the day, it's the human resource which is the most important. So if we can provide them with the expertise, train them well, establish the center, and keep a link, that would be what we are looking at. And we are hopefully, once we are over with this COVID episode, we'll move in that direction.
Yeah. Dr. Hussain and Dr. Aneeta, one question is, what do you face in terms of the barriers for people to donate or for people to engage with NICH in Pakistan? How do we overcome those barriers? In the US, I'm specifically talking about. What are their people's concerns for donating?
I'll give it my 2 cents, and then I'd love to see what Aneeta has to say. So, there are 2 or 3 areas which are of concern for people generally when it comes to donation. Number one is transparency, as I'd mentioned. And that's the reason I was emphasizing on that very clearly, because the money has to be tracked, especially now post 9/11, where you don't want even indirectly to be involved with anything that's considered shady. Number two, with no, please do not take this as anybody as a personal statement, but in a generic term, since you asked, one of the generic things that have people are worried about is the track record, which anything that involves the government in Pakistan. That will that be utilized properly? How long is this government going to last? What are the barriers? Is there a cooperation between people like Dr. Jamal, who themselves absolutely are impeccable in terms of their record, but will they be allowed to work? Will they be hand tied? Then the third issue is how much of what people donate is actually percolating down to where it's needed. And as you very appropriately asked the question, how much of this budget is spent in marketing? And so, what are the exact expenses and what are the exact needs? So those are the concerns. And then the fourth concern, which it didn't apply just to NICH, but it's general, but nevertheless a very formidable one to tackle, is what's called donor fatigue. Because if you think about it, anything that happens in Pakistan, it's somehow always expected that the expatriate Pakistanis or people who have migrated to different countries, whether it's the Middle East, whether it's UK, whether it's United States, since we are financially in a situation which are much more better and stable, that we will step up to the plate. Trust me, overwhelming majority of the people have very good intentions, really want to do it, but there is a finite number of people doing it, and sometimes an infinite number of needs. So you have to be very careful on how to lay out what your needs are. And again, hate to use the word, but be competitive with the other charities also worthy of your attention.
So so in that competitive landscape of where donor fatigue exists, how do you sell yourselves and make yourselves what's your unique selling proposition, to use a marketing term for?
Right. So the few unique things for NICH are as follows. Number one, not too many places in Pakistan and are doing what NICH does. Tell me, I cannot recall over the top of my head or with evidence any place which is dedicated purely for children's care, right from the scratch, walk in, walk out, not a dime charged. Every service state of the art. So it's not just that it's inexpensive or it's free. It's that the state of the art services which are not available anywhere. Number two, as you had mentioned right now, there are some great hospitals in Pakistan and in Karachi that are doing work, Aga Khan and so many, but not too many hospitals that are dedicated only for doing stuff for children. And that's why NICH needs our attention. I'm not a pediatrician. I got nothing to do with children. But the only reason I'm attached with this is the uniqueness of what this offers. And children are our future. I mean, you've heard this repeated so many times that Pakistan is very uniquely placed in the global atmosphere and the global picture, that we have the biggest proportion of people who are under the age of 30. So if you've got such a young population, this young population obviously will have children, and the number of children is increasing, and we need services for children. There's so many worthy adult hospitals, not one that I can say which is doing job like NICH, dedicated directly and only for children without any money needed from the parents or the patients coming in. So that what makes it very unique. And I think me putting my face on it is a cry for help, saying, look, I got nothing to do with pediatrics, but gosh, I want to jump into this and do what I can to help the children, because if we won't, who's going to step up? I mean, how many children's hospitals do we have? And Professor Jamal wants to take this beyond Karachi, but oh my God, Karachi needs so much right now. It's attracting so many people from interior Sindh, from Balochistan. It's staggering, the numbers and the need. So I don't see any other entity doing what they're doing. I don't see any other institute providing what they're providing in the capacity that they're providing. So that, for me, enough to make it competitive. And children are our future. If we don't invest in the children, how do people who sit outside Pakistan keep talking about improving the conditions there? How are you going to improve the conditions unless you safeguard the future of your children? So we have to. For me, that is the biggest selling factor.
Yeah, thank you, Hussain. That's a great, really help on very nice words. एक request है. I will only say one thing, George, to what you were saying. The USP, I think the most important USP for us, for anybody who is based in Pakistan, would be that I would request them to visit the hospital. Once they have seen the place, then they will be a convert. Sorry, I think, George, we lost you. What I was saying, the USP for us would be anybody based in Pakistan, I would request them to visit the hospital once. Once they have seen what is happening here, then they will be the convert.
Yeah, and anyone who wants to also donate, there are the bank details for Pakistan are on the screen below, but also in the comment section below, in the description section for both Facebook and for YouTube, we'll have both the bank details for US and Pakistan. But as Dr. Jamal absolutely said, go and visit NICH, and you will be blown away, and you will obviously see the wonderful work that they're doing. And honestly, you won't ever, it will change your mind completely. So about the work. So I just wanted, Dr. Aneeta, any last words from you?
I think Hussain did a very good job, presented it very eloquently, and I think that's it.
So I just want to sort of, before we leave, I just want to bring in, I think I've frozen again. Can anyone hear me?
Yes.
Yes.
Sorry, I just want to bring in a little clip from this video that I've been sent, just for you guys to watching at home, just to feel and see the wonderful work that NICH is doing. So let me just play this for you, and just a little bit of the clip.
We should feel responsible for these children when they are sick, and it's our responsibility to make them better. Most of the time, the children that come to the emergency are in an extremely precarious condition. More than 150,000 children every year are given medical treatment in just the emergency centre alone. And we will not turn them away, even if the hospital is overpopulated. We will always find room.
NICH, or National Institute of Child Health, is the largest children's hospital in the southern side of Pakistan.
With great size comes great responsibilities. The ICU in the NICH is a unique facility because of the expensive service it gives to its patients.
So just a little clip there, just to give you a sense of the work that you do. But thank you so much, everybody, for joining us today. I'm sorry, I think I've frozen again. I don't know if you can hear me. Hello?
Yeah, we can hear you.
Yes, you can. Yes, we can hear you. Yes.
I would just like to thank everybody for taking the time out to talk about NICH. And Dr. Jamal, first of all, thank you for all your wonderful efforts in leading the hospital.
Thank you for having us here.
Introducing the important work of adolescent and child psychiatry to NICH. And Dr. Hussain, thank you for all your legwork in getting, as treasurer of the USA chapter, and getting the charitable status for the organization. So thank you, all of you, for taking your time out today to speak to us.
Thank you very much for the opportunity.
Thank you.
Thank you. Okay. So, Dr. Jamal, any last words from you?
No, we really appreciate your work, and we, extend our prayers for all of the country in this difficult times. Allah Ta'ala sabko sehat de, and we really take this opportunity for you to stay safe in your homes, to stay safe with your children, take care of the health of your children, both physical and mental, and also take care of health of others' children, because hum sab ek saath hai, and any child is our own child, and the children are the future for this country. Thank you very much.
Absolutely. Well, thank you so much, sir. Thank you.
Thank you.
Take care. Right. So that's it. That's all we have time for this edition of At Home with George. Thank you so much for watching. And if you haven't been able to watch the entirety of it, it is now live. It's now there on YouTube and Facebook for you to watch. And I'll be back again this time tomorrow at 11 o'clock. Till then, goodbye.